I've got a question for you.
What?
I don't know if you've ever pondered this. I've pondered this.
You? No.
All right. Let me finish. Have you ever wondered why in a patriarchal society we list lesbians first?
Oh. I've heard things about this before, but I don't know the specifics.
Incoming broadcast. You're listening to .fem.
Welcome to .fem. I'm your host, Danielle Gonzalez.
And I'm Claire.
And today we're talking about the AIDS crisis. Specifically, we're talking about how the community came together to survive the crisis.
Yeah.
To fill those social needs that governments and other institutions either couldn't or, in most cases, simply just wouldn't.
Yeah. Yeah,
you sound like you have thoughts.
The thoughts that I have are that, like, the queer community is once again forgotten about.
Yeah.
And here we are again,
Yeah.
Yeah.
Yeah, and I think that's a good disclaimer, is that everything we talk about today, we are talking, from the perspective of the LGBT community. But the organizations that we're going to talk about today, the, different community initiatives and everything, is not just queer community specific. Like this, these were organizations that helped straight folks who were also suffering from AIDS, drug users, this was a multi-community social investment. First, I think briefly, I want to sort of set the scene.
Excellent.
In the last two episodes, we did like a brief overview and talked about like the political environment, and then we talked about the scientific and medical environment and everything surrounding it. But we haven't really, apart from briefly as it sort of intermingles with the political environment in the first episode, we haven't really talked about like the social environment.
No.
The social makeup of the United States going into the early 80s. And something that we briefly touched on that I think it's worth touching on again, in the mid to late 70s, there was a queer acceptance that was sort of on the rise. Now, it was social acceptance, right? To be clear, legally, queer people did not have legal protections in employment, housing, healthcare, all that kind of stuff. And, today we still kind of don't. But in the late 70s, we were starting to see a social queer acceptance. And a lot of this was showing up in TV and movies. We're seeing new characters that are more positively representing the queer community. Now, most of this was for gay men and lesbian representation, not so much for trans representation. But there was still this social acceptance that was kind of on the rise. And as we see with a lot of laws changing, we're literally witnessing it right now with cannabis.
Yep.
Is that as social attitudes change, that pressure on lawmakers to change policy happens. So it's entirely possible that what we were seeing in the mid to late 70s could have created a social pressure to change policy to allow gay marriage and legal protections for queer people at a time when it otherwise wouldn't have happened. Right. But unfortunately, obviously, the AIDS crisis happened. This was like, for folks on the Christian right, the AIDS crisis was like a biblical plague. It was something that people could point to and be like, see, God also says.
Yeah.
It gave this convenient pretext to really ramp up that social stigmatism and be like, this happened because we were starting to be okay with gay people and we're not supposed to. And God told us we're not supposed to. And so they started to roll that social acceptance back, and it really set the community back a lot. So that's the environment that we're in.
Yeah.
So not only did AIDS patients have to suffer from the disease itself and everything that it did, because, like, let's be very clear about that. Like, a diagnosis of AIDS at this time in the early 80s, pre-1996, was a death sentence. It was expected that if you were diagnosed with AIDS, not HIV, but AIDS, the advanced stages of HIV AIDS, you were given 2 years on the outset. Probably not even that. I think most people were given, within 9 months at the time of their diagnosis. And a lot of these symptoms that you're experiencing suffering from AIDS are pretty debilitating. I mean, these are, extreme chronic fatigue and colds that last months, It's stuff that will take you out of work. All of that is important to remember. So not only do AIDS patients have to suffer from the disease and everything that it does, but they also were finding that they had to become their own clinicians and caregivers. They had to be their own scientific researchers, their own pharmacists and drug smugglers, their own support groups, their own lawyers and lobbyists, their own churches. And they, created their own grassroots libraries, laboratories, drugstores. There's a well-known AIDS activist, Peter Staley. He was quoted as saying, "It's like living in a war. People all around me are dropping dead."
Wow.
And the government and most social institutions, like schools and churches, they're not doing anything to help because there's this pervasive fear about, how do people get it? Could I get it? So there's a lot of folks that don't want to associate just because they're afraid of getting the disease.
And you got the Christians.
There's a lot of people that are still associating it with the queer community and premarital sex and sex work and drug use, things that are seen as kind of immoral, especially from like the Christian side of things. So people don't want to, interact with folks that have it for fear of being spiritually unclean and all that kind of stuff.
Ooh.
And so in this community, we see people really kind of trying to fill those gaps that society is leaving.
You have to rely on the community, all through and through. And like through this whole thing, the gay community, it's so obvious the impact that it had on them and their lives. And, even in my time here in Seattle, when I first moved to Seattle, I was sort of some trans elders, put their arm around me sort of thing and like taught me a lot about called LifeWise, I think. Is that right? What's the place in Capitol Hill that does AIDS testing?
Oh,
it's like right around the corner from you.
Lifelong.
Immediately introduced me to Lifelong, gave me a bunch of like pamphlets, on AIDS and sexually transmitted diseases, and just like brought me into the throes so quickly. And like, again, it's that sort of idea of like, we don't want to live through this again. And that sort of mentorship was just thrust upon me. Like I didn't ask for it.
Right.
I'm glad it was. I needed it at that time in my life. And I was immediately connected to all these resources that I might have needed. And that's something that Dr. Fauci talked about too in his interviews of like every interview that he had. What was that quote that he said, Dany? Well, that was such a profound quote.
Oh, which one? He had a lot of those.
The one that he was like, the gay community is the blueprint for the future.
I describe my relationship with the LGBT community, particularly gay men, but also beyond just gay men, as you say, in the queer community. My relationship with them that I developed over those early years in the mid-'80s to the late '80s, I believe is one of the most important experiences I've ever had in my life, one of the most positive experiences, even though if you go back and see the confrontation and the iconoclastic disruptive behavior, that was beautiful actually, because what it did is brought attention to things that could have been done better. What they did not only was important for HIV AIDS, but it set an example of the importance of advocacy in any disease. And the idea of advocacy of the afflicted community, the situation and the experience with AIDS was the successful prototype of that. So I think historically, this is going to be a very, very important relationship. It already is recognized as that. But I think 50 years from now, people will be talking about that relationship between the gay community and myself and the scientific community and the regulatory community.
Exactly. That's the one. Exactly.
Yeah. And in this episode, we're going to talk about these different groups that are filling these different, holes in society. Now, obviously, we can't go through every single group that popped up. There were a ton of them. So we're going to do one example of each category that we gave. But I'd like to start with the San Diego Blood Sisters.
Ooh.
This is the answer to that question I posed you at the beginning of the episode.
Say it out loud.
Vampires.
Yeah, you got it.
Hey.
All right. So
Is this about the lesbians, or is this like one part of the lesbians?
that's one part of it.
Ooh.
So in 1983, there was a ban on blood donations from certain at-risk groups for HIV. But, the groups that were most targeted by this ban were gay men, or men having sex with men, and intravenous drug users.
Oh, yeah.
Lesbians, however, were still permitted to donate blood. Side tangent. This ban remained in place until 2023. Did you know that?
Kinda. Like,
Honestly, I thought it was still on the books. I'm surprised it was pulled in 2023, but the fact that it took that long is still
well, that's there's still a lot of stigma. Yeah.
Yeah. It was instead replaced with a personal risk assessment, which, hey, crazy idea. Maybe that's what we should have been doing the whole damn time. But, Anyway, since lesbians were still permitted, there was a group in San Diego in 1983 that was formed called the Blood Sisters. They were formed by members of the Women's Caucus of the San Diego Democratic Club, and the whole purpose was to increase the blood supply for AIDS patients who were suffering from anemia, a lot of whom were gay men. Like we talked about in the last episode, one of the biggest groups that was affected by AIDS were gay men and trans women.
Yep.
And the treatment for a lot of the opportunistic infections and diseases that AIDS patients were suffering from was blood transfusions. There were a lot of blood transfusions that were needed, but there were a lot of groups that were not allowed to donate blood. So we were beginning to experience a blood shortage. So the Blood Sisters was formed on July 16th, 1983. There were 3 founding members among a few others, but 3 important ones. Wendy Sue Beagleisen, I believe, is how you pronounce that, Nicolette Ibarra, and Barbara Vick. They organized this first blood drive for the San Diego Blood Sisters at the San Diego Blood Bank in Hillcrest, where nearly 200 women volunteered, and it resulted in 130 donations, which is pretty good for, a first blood drive.
Yeah.
So it's pretty awesome. And this whole movement inspired numerous Blood Sisters-like groups across the country. Too many to name here. But in 1984, the Blood Sisters of San Diego received an award from the National Gay Task Force, though there was a significant amount of conservative backlash. There
usually
were a bunch
is.
of religious groups that threatened to hold donations if the director of the NIH at the time attended the award ceremony and stuff like that. It was just nonsense. But, the Blood Sisters received an award in 1984, and the Blood Sisters operated actively for about 4 or 5 years. In fact, the reason that they kind of sort of de facto went away was because by that point in time, the Reagan administration, and later, arguably more importantly, the senior Bush administration had actually started to formally intervene in the AIDS crisis.
Huh.
The government was finally coming in and doing
Yep.
what governments are supposed to do.
Yep.
But until then, we had the Blood Sisters. And a lot of these women who were donating were lesbians. They were,
Yep.
you know, lesbian women who, even though there was this big, you know, kind of schism in the queer community between lesbians and gay men, they were willing to put that aside and come in and donate blood and act as caregivers for the gay men who were sick and dying.
So
And
the L in LGBT comes first because lesbians are like honored during like
that
this
is a
dark
way
time.
that we as the queer community honor the lesbians of our community for acting as caregivers. And
Vampires.
blood donors is the word.
Nice. Cool.
Yeah, I mean, prior to 1986, I think it is when you really start to see this happen. But like prior to the mid 80s, the acronym that you always see, especially in like official literature,
Yeah.
is GLBT.
Oh, yeah.
And you still see that today from time to time, especially if it's like an older group.
I think we learned that with the Magnus.
Yeah.
Yeah.
Yeah. Especially if it's like an older group that still exists today, you'll see that acronym. But a lot of acronyms changed to LGBT after the mid 80s, specifically to honor the lesbian community. And, you know, the Blood Sisters and blood donation is not the only way that lesbians took care of the community at this time, but this was a big way and kind of my favorite way, if not only because the name Blood Sisters is awesome.
Blood Sisters.
But that's why the L comes first.
Nice.
Which, you know, I think is pretty cool. I think it's pretty fun. But, of course, it wasn't just clinicians and caregivers that the community had to become.
No.
They had to kind of become their own researchers. As we're going to talk about with ACT UP next episode, there was this huge gap in research.
Yep.
And so there were a number of community initiatives that popped up in order to sort of do their own research because the scientific community was moving too slowly around it. One of those is a group called ACRIA, which stands for the AIDS Community Research Initiative of America. It was founded by a man, Michael Callan, who was an AIDS activist, and Dr. Joseph Sonnabend, who was his doctor, actually.
Oh.
They founded it in 1987 as the Community Research Initiative. It became known as ACRIA later, but one of their earliest achievements was a trial, a medical trial, that ended up contributing to a drug being approved by the FDA to help prevent pneumocystis pneumonia in AIDS patients. And remember, pneumocystis pneumonia, or PCP, was one of the most serious opportunistic infections that AIDS patients were finding. It was, in fact, it was what the initial cluster in Los Angeles and San Francisco was presenting when they first began to identify HIV.
Right.
So being able to treat this pneumonia was very important. It was allowing people with AIDS to live longer because, again, it's not necessarily the HIV that kills you. It's the opportunistic infections that kill you because your immune system has been so weakened by HIV that it can't fight them off. So if you're able to use antibiotics to fight off those infections to help your immune system because it can't, you can live longer. So this is a very important thing that ACRIA was able to do. And they helped organize other trials throughout the years. And in fact, ACRIA is currently recognized as the international authority on the emerging issue of HIV in older adults, because, you know, this is kind of the first generation that's been able to live long enough into elderhood with the disease.
Right.
It is kind of an emerging medical issue, and ACRIA is kind of on the forefront of researching that. So they're still around today, still doing great work. But yeah, they were incredibly important simply in terms of doing community research.
Now, this ACRIA ACRIA was found in 1987. Where were we in like the grand scheme of things at this time? Like, were we stabilizing things? Was like AIDS becoming, how did we describe it? AIDS was in remission?
No, the AIDS crisis didn't, stabilizing is such an interesting word. I wouldn't consider the crisis as stabilizing until 1996 when the triple drug cocktail HAARP comes out.
Right.
That was
so we're like in the middle of it right now.
Yeah, we're still in the heart of the crisis. People are dying left, right, and center. I believe by 1987 it was something like 500,000 Americans were infected and like 60,000 had died that we knew of. I probably have those numbers wrong. There were a lot of numbers that we went through in the first episode, so I'm probably getting them confused. But yeah, 1987, it's still pretty heavy.
It's interesting to see these dates because, like, you can kind of get a sense of just how important it was to find these cures and find help. Because I'm looking at some of when of these groups were founded, and Blood Sisters was 1983.
Correct.
The ARCA was 1987, and our next group, the PWA Health Group, that was in 86.
Yeah, so it's these community groups are popping up throughout the whole span of the pandemic. But you're right. It very much goes to show for just how long the official social institutions were not stepping in to help. And
the seriousness of it too. Like, there's so many groups.
Right. The first cases of HIV were identified in late 1980,
right,
early 1981. So we're almost a full decade into the crisis, and this kind of stuff is still having to happen. 1984 was when they discovered the HIV virus.
Right.
So it's only 3 years after they discover the cause of AIDS, but AIDS has been happening for almost a full decade. So things moved pretty, in terms of like support and understanding of what was happening, things moved very slow.
Yeah.
In terms of like the severity and mortality, things were moving at light speed, which is not good if those two things aren't matching up.
Exactly.
So, but you're right. In the next group, PWA Health Group, or the People with AIDS Health Group, became sort of a community pharmacy. And there were a lot of these types of groups. These were called AIDS Buyers Clubs. In fact, do you remember that movie from 2013, Dallas Buyers Club, that Matthew McConaughey was in, and Jared Leto was cast as a trans woman, and there was this big
the one with Matthew McConaughey and Jared Leto, who was cast as a trans woman.
Yeah, that thing I just said? Yeah, 2013 Dallas Buyers Club is about a similar group that, again, is based off of a real story from Dallas. It was based off of a Dallas Buyers Club. But yeah, these AIDS Buyers Clubs were very important. But PWA Health Group was the largest buyers club in the United States. It was founded in 1986 by patients Thomas Hannon and, again, Michael Callan, who we just talked about, with their physician, their doctor, Dr. Joseph Sonnabend, who Dr. Sonnabend helped found a ton of community groups during this. And honestly, he probably deserves like a 4-hour documentary just about his work, not even just in the AIDS crisis, but just his work as a doctor. Very impressive. But yeah, Thomas Hannon, Michael Callan, Joseph Sonnabend, they founded this group. And these types of groups became more and more important, especially early on in the crisis, because they were a means for people to get medications from other countries that other countries like France and Belgium and Japan were approving for the treatment of HIV, but the FDA had not approved yet here in the States because our scientific community was moving slower.
Right.
Like, there was a certain way we did things in the scientific community that were long trial periods to make sure that treatments were safe. And it took many years for a drug to be proven safe in our system for it to be approved. But it was not by any means the only way to do that.
We were going as fast as we could, but understandably, the venue in which this was done was the classic careful venue of highly restrictive clinical trials with inclusion and exclusion criteria, where in order to preserve the pristine nature of the trial to get results that were durable and correct, which served us very well for other diseases in which there were alternative therapies, such as with heart disease and hypertension and a number of other diseases. So at first, the scientific community, understandably, but inappropriately, did not really listen and was saying, we know what's best for you, which today in 2025 sounds outlandish. We know what's best for you. But they meant it sincerely because they were trying to help. These young, mostly gay men had no other alternative but getting access to drugs that weren't even proven to work yet, but they at least had a chance because of the way the scientific and regulatory community was so rigid that they felt they wanted a seat at the table. They said, this is our lives. We're seeing our friends dying. We're afraid that we're going to die, and many of us will die. So we want you to be more flexible in your access to us of clinical trials. Do the math. Drugs take anywhere from 6 to 10 years to get approved. I'm going to die in 12 months to a year. Do the math. It's not working for us. So we've got to have other access, a parallel track, which Jim Igo in The Village and Marty Delaney in San Francisco were pushing for.
So it wasn't the only way to do that. So other countries were doing things faster. They were approving different drugs that people here in the US were hearing about in international news, and they wanted access to those drugs because why wouldn't you? You're dying without them. So literally give us anything. Let's throw everything at the wall and see what sticks. That's how AZT was approved in this country. But again, AZT was already a drug that existed that was proven to be, safe-ish.
Yeah.
For
helpful.
Cancer patients.
Yeah.
It was a drug approved for cancer patients. So AZT got kind of fast-tracked because it was already a drug that was kind of approved. But there were other drugs internationally that were getting approved much faster in other countries. Mm-hmm. And so these AIDS buyers clubs consisted of people that would, drive to Mexico to pick up these drugs like ribavirin and dextrin sulfate and DCNB. Or remember, last episode we mentioned that AZT was given a patent by the government and they were allowed to charge $10,000 a year. Mm-hmm. You can make versions of AZT that were cheaper in other countries, but because it was patented here in the States, you couldn't get it cheaper. So they were also bringing in pirated versions of AZT. Like, we talk here in the US about like name brand drugs versus the generic. Yep. You could get the generic from other countries, but you couldn't get it here. So these buyer clubs were bringing in the generic of AZT.
Interesting.
They were a means for people to access these, very promising, but still considered experimental drugs and treatments. But in addition to that, they were also beginning to provide education around the disease itself, around various treatments, including the experimental ones from overseas, and providing support to people with the disease, like giving info sheets on those latest treatments and trials, but also on dosing and practical treatment strategies and things for dealing with various side effects like wasting away and chronic fatigue and that kind of thing. So these types of buyers clubs and health groups were very, very important. PWA being the largest was especially important. I think they operated out of New York. So, but they were by no means the only support groups that popped up.
This episode of .fm is supported by our Patreon, duh. Come on, you think a tiny trans podcast like us would have sponsors? I wish. No, we're supported entirely by our listeners. We're kind of like PBS that way, only queer. Patreon.com/.femme. That's patreon.com/DOTFEMME.
Reacquiring signal.
A really big one, Gay Men's Health Crisis, or the GMHC, was a huge one. They were founded in August 1981, pretty much right after the crisis was starting. As soon as these cases were identified and confirmed, gay activists, and one leader especially, Larry Kramer, we'll talk all about him next time, he hosted a group of other gay activists, a group of 80 men, in his New York apartment to talk about this new issue that was being called gay cancer or gay plague at the time. Remember, this is before the word AIDS had even been coined. So they, were worried about this thing that was beginning to sweep through the gay community, that was causing gay men to come down with Kaposi sarcoma in New York City. And they started to organize and raise money for research around what was happening. But in early 1982, 5 men, Lawrence Mass, Paul Popham, Paul Rappaport, Edmund White, all met with Larry Kramer again, and they founded the Gay Men's Health Crisis. And they decided to take the name from, the earliest victims of AIDS, which were these, gay men.
So wait. Who is the GMHC?
It was this sort of a support group, general sort of activist group that raised money and did social organizing and speaking and stuff that they would then distribute to other groups, like medical researchers that are trying to research the disease.
Got it. And Larry Kramer is
Larry Kramer was one of the founders.
Cool.
So he's also the founder of ACT UP, which is why we'll talk about him next episode. But
nice.
And at this time in 1982, Gay Men's Health Crisis was the largest volunteer AIDS organization in the world. This is very early on in the crisis. So my guess is there probably aren't a lot of volunteer AIDS organizations at this time.
No.
But there were a few, because the crisis had been going on for about a year at this point. Yeah. And so that's still in and of itself a large achievement.
Longer too, depending on where you're, coming from. In Haiti, when did this whole thing start? Like 1977 or something?
The first confirmed death from AIDS occurred in the Congo region in 1964.
Yeah.
So the AIDS crisis started in the United States probably in the late 60s.
Yeah. And
a lot of cases were misdiagnosed or ignored or attributed to, an opportunistic infection.
Right.
It's so hard to put a starting date on when did AIDS start in the United States.
Yeah, there was no patient zero.
Right. I mean, there was a patient zero that we think of, but he was so maligned for no reason of his own that I didn't want to talk about his story here, because I didn't want to contribute to that, even though I think now he's been kind of vindicated, and rightfully so. But yeah, there was a flight attendant based out of Montreal who was considered patient zero for, the New York and San Francisco groups.
I mean, my point was, it's it's early here in this, the 1980s, of course. In 1982, the Gay Men's Health Crisis started. But for some groups, this is, late, this could be 12 years afterwards,
Sure.
And so there's just that perspective.
Yeah. And to be fair, I think that even though we consider the AIDS crisis as starting in late 1980, because that's when we first identified those cases in those clusters, there was still a, nameless boogeyman in these communities that the gay community and the drug use community were talking about in the 70s. Right. About friends who were suddenly coming down with some mysterious illness and wasting away. So You're absolutely right. For a lot of people, this has been happening for a while.
Right.
But it just didn't have a name or a defined start date.
Absolutely.
So yeah, that's a very good point. Where were we? Gay Men's Health Crisis. So yeah, they're raising money and, beginning public organizing. They're also just starting to do general, education, were hearing from certain doctors that this might be STD related. So wear condoms, putting out zines and pamphlets. Zines was more of a 90s thing, but pamphlets.
Zines are on the way back, baby. They're coming back.
They never went anywhere. They've always been here. But yeah, that was by no means the only way that the GMHC began to help the community. Roger McFarlane, who was a gay activist and AIDS activist, he became the first executive director of the GMHC. But before he was executive director for GMHC, he started a crisis counseling hotline from his own living room telephone.
Awesome.
And after becoming affiliated with GMHC, that hotline, which grew, became one of, if not the most effective tool for sharing information about AIDS that the gay men's health crisis had. It was a number that if you suspect you've been exposed to AIDS or that you are experiencing what you think might be symptoms of AIDS, call this number. You can get more information. They can help you find a doctor to talk to, that kind of thing. Very, very important. It was huge. It was a very important support group. So by 1984, the gay men's health crisis was assisting the CDC in planning public conferences about HIV/AIDS at the CDC's request. The GMHC did not go to the CDC asking to help. The CDC came to them and asked for their help. So they were big. They were a very big group, very important work that they were doing. And by 1986, the GMHC was assisting all victims of AIDS, not just gay men. They were helping straight men and women, drug users, even kids who were coming down with it. Because something we didn't really talk about a whole lot last episode, and after doing some editing on that episode, it's definitely hindsight, but something we definitely should have spoken about is that one of the ways that you could get HIV was by breastfeeding. Infants
I've heard
breastfeeding
of this.
from an infected mother could do that because the 3 cells that the HIV virus infected were CD4 T cells. That's where, your T cell count comes from, but also macrophages and dendritic cells. Those are present in breast milk, because that's how an infant sort of builds their immune system and how it gets sort of trained. It gets trained by mom, more or less. And so, you can absolutely, if you were an infant whose mother was infected and you somehow didn't get the disease in utero, you could absolutely get it by breastfeeding. So there were children coming down with this through breastfeeding or, transfusions. Like we talked about, the first infant case that had AIDS was from a transfusion because they were born premature and needed transfusions. That's how they figured out the blood supply was tainted. So there were a lot of different ways to get it. But breastfeeding was absolutely one of those. And gay men's health crisis by 1986 was also, providing education for expectant mothers about that and that kind of thing.
That's awesome.
And assisting, children that had it. So it was a very big,
huge community
big
support.
Group.
Yeah.
Massive group. This is gay men's health crisis is honestly one of the community organization blueprints in my mind, for community built organizations in general.
Yeah.
Right. So huge group. But as we get into the later period of the crisis and this social stigma has really, taken root, we start needing additional support, like lawyers.
Yeah.
Because, like we talked about, it's still legal to fire people for being gay or trans.
Right.
And if you are diagnosed with AIDS, you might be assumed that you're gay and your employer will just fire you.
Whoa.
Also, people are scared of contracting the disease and there's not enough education going to the public about who can catch it and how, right? So, for instance, there's a case in 1994 that this group, the AIDS Law Project, which was founded in 1988 by David W. Weber, it was headquartered in Philadelphia. They mostly worked in the Pennsylvania and New Jersey regions. But again, the AIDS Law Project in Pennsylvania was not the only group like this. For every one of these groups we talk about today, there are a number of groups that were, founded
these are just the most
alongside of or
prominent.
inspired by. These are just, some like top examples. But the AIDS Law Project, they provided free legal assistance to people living with HIV/AIDS, whatever that legal assistance might be. So in 1994, there was this case where the AIDS Law Project sued the city of Philadelphia on behalf of an AIDS patient or someone with AIDS that was refused treatment by a couple of EMTs.
What?
And the EMTs refused to treat this patient because they were afraid of contracting the disease.
Oh.
Again, that's the thing. There wasn't enough public education happening about how it gets transmitted. So there were a lot of like doctors and a lot of nurses and EMTs who were, hesitant to treat patients because they weren't sure how it was being transmitted. And not so much doctors, more just EMTs, but the AIDS Law Project sued the city of Philadelphia, and they ended up reaching a settlement with the city that caused the city to implement AIDS training for all emergency personnel to try and prevent this from happening again. Of course, it did happen again. But, AIDS Law Project sued them again, and it's, this slow march towards progress. Another really important case, and one that I think is particularly interesting, happened in 2007. Now, the AIDS Law Project was able to secure health insurance for a woman who was suffering from AIDS. Now, this woman had been diagnosed with AIDS, I think, in 1994, prior to the triple drug cocktail, HAART, or HAART. So when she was diagnosed with AIDS, AIDS was terminal. And knowing that, she sold her life and health insurance policies to what's called a viatical settlement company, which is just a company that specializes in purchasing health or life insurance. And she took that money to pay for her health care, or, what was at the time considered hospice care. But she survived long enough to get the triple drug cocktail and was no longer considered terminal. At which time the viatical company that was paying her for her policy decided, we're not going to pay you anymore because it's not considered terminal anymore. And that's our whole thing, is we buy terminal cases and you're not terminal. So we're not going to pay you anymore. And that's kind of bullshit.
That is bullshit.
So the AIDS Law Project took on her case, sued this company, and forced this company to continue to pay for her health insurance premiums. And that's an example of like the Lazarus effect that, we saw happening a lot at this time leading up to 1996, where people that were diagnosed prior to 1996 thought they were going to die. And if they happened to live long enough to see this treatment for AIDS come out in 1996, suddenly they're not going to die. And that's a big part of why you need, these types of support groups and these lawyers and, groups like the Gay Men's Health Crisis, because remember, people that are suffering from AIDS are also people that are too sick to work. So a lot of them have either been fired or they've been like on medical leave indefinitely or long enough that they've just sort of de facto lost their job because they could not work for them. And now that they're getting better, they have to essentially start their life over again. Right? There were people that, they were too sick to work, so they couldn't afford to pay rent, and they basically stopped paying rent because it was like, well, who cares? By the time I get evicted, I'll be dead anyway. But now suddenly they're not going to die. And now they're saddled with medical debt and back pay for rent and all that kind of stuff. So you need a support network to help you figure that out. And there were a lot of people that did not figure it out, and they ended up taking their own life because they didn't know what to do. Because if you think for up to 2 years you're going to die, and you live your life knowing you have that expiration date, and then suddenly you don't have that expiration date, you might not be able to see past that date anyway, so you just make it your expiration date. The Lazarus effect is a it's a real deal. You know, it was a big issue. So we also see organizations coming up like as lobbyists trying to really lobby for these social changes that are needed, especially as the crisis goes on. One of those was the Names Project, which I'm sure you've heard of, the AIDS memorial quilt.
I think so.
That's the main thing that came out of the Names Project.
Okay.
This project was initially conceived of in late 1985 by gay activist Cleve Jones. He was Harvey Milk's protege.
Oh.
And Cleve Jones sort of came up with the idea during the annual Candlelight March in San Francisco that was in remembrance of the assassination of Harvey Milk. And for that particular march, which again happened every year, but for this particular one, Jones asked that people participating write the names of their loved ones that they had lost due to AIDS on signs that when they reached the San Francisco Federal Building at the end of the march, they taped up on the building. And Cleve looked at all of these signs with these, you know, names and makeshift memorials on them and thought that it kind of resembled this enormous patchwork quilt. And that's where he came up with the idea for the Names Project and the AIDS Memorial Quilt. At the time of the AIDS crisis, there were a lot of people who died from AIDS that did not receive funerals because of social stigma, but also because funeral homes were just straight up refusing to handle the remains of people that died from AIDS. Again, scared of the disease.
Right.
And like, I get it. It's a very scary disease. But since there were so many people who died that didn't get to have funerals, these quilt panels, these handmade quilt panels, were a lot of the time the only opportunity for loved ones to remember and celebrate the victims of the crisis, the people that they had lost. So it was a very moving and like emotionally touching moment when this AIDS quilt went on display for the first time in 1987 on the National Mall. And you know, at this point, more than 40,000 Americans had died from AIDS. I think I said 60,000 earlier. The number's 40,000, more than 40,000. So this quilt comprised of nearly 2,000 panels, and each panel was 3 feet by 6 feet.
Wow.
Big. These are big panels.
Yeah.
So this is a very large quilt. It covered an area that was larger than a football field when it was first unveiled in 1987. And at this memorial, participants read the names of all the deceased aloud. And that, you know, became a tradition that would happen every time the quilt was displayed. President Reagan and his wife, Nancy Reagan, they flew over in a helicopter to view the quilt from above. And Nancy Reagan later described it as very touching. In fact, she broke into tears in the helicopter, you know, so that's something. It was very moving for people. So, and it continued to grow. You know, the AIDS quilt still exists today. By 1996, the Names Project and the Memorial Quilt had raised more than $1.7 million for AIDS service organizations like ACT UP and the Gay Men's Health Crisis, those types of organizations, as well as like research organizations. And it continues to grow today. As of 2022, I believe, the quilt consists of more than 50,000 panels, each one 3 foot by 6 foot, and it currently weighs an estimated 54 tons.
Wow. Where is it stored?
It is stored in a warehouse in San Francisco.
Wow.
It takes a very large team of people to carefully transport and unfurl it every time it's displayed.
Wow.
Yeah, it's massive. I haven't seen it in person. I've seen photos of the 1987 event. I've seen photos of, I think there was a display of it after September 11th. And in fact, the AIDS Memorial Quilt inspired a number of similar memorial quilts for other things, including 9/11. There's a 9/11 memorial quilt.
Wow.
But I've seen pictures and it looks incredible. I would love to see it in person sometime. So maybe next time it gets displayed, you and I can go on a field trip.
Yeah.
But it was and continues to be so important. Cleve Jones was quoted as saying it worked on so many levels. It was therapy. It was a way to encourage people to talk and share about the disease. It was a weapon to shame the politicians for their inaction.
Oh.
It was a way to remember the dead. What a perfect symbol, a perfect middle-class American traditional family values kind of symbol to attach to this disease. And maybe, just maybe, we could apply those traditional family values to my family. So it worked. It really worked.
It's so interesting to hear this story of Clive Jones and Harvey Milk. Yeah, I can see how like Clive Jones was inspired by Harvey Milk and took on, so much of this activism as well. As you said, like he was kind of his protege. So
he was, he was like handpicked by Harvey Milk to, so, but of course, lawyers and lobbyists aren't the only thing that people need at a time where they're dying. And one of my favorite groups, because I've actually gotten to interact with them in person.
Yeah, they're all around. They're all around Seattle.
So fun.
They are.
But if you haven't heard of the Sisters of Perpetual Indulgence, I highly encourage you to look into the Sisters of Perpetual Indulgence. As their name suggests, they are an order of nuns. Gay nuns. Gender fucking nuns. Super fun. The Sisters of Perpetual Indulgence predate the AIDS crisis. They were actually founded before the AIDS crisis happened. But it was really during the pandemic that they kind of found this new mission of spirituality. When they were originally founded in 1979 in San Francisco, it was mostly as a critique of organized Christianity's, like what they called archaic moral attitudes.
Makes sense to me.
Yeah, and they did so using camp, and they appropriated a lot of Catholic symbols, like, a nun's habit and everything.
Which they still
do. To make this very loud and campy statement about gender and sexuality. When AIDS came to the Castro in San Francisco, the sisters started to more publicly critique and challenge the Catholic Church and their moral grandstanding. Because there was, the Catholic Church had an official stance on I'm not going to go into like the history of the Catholic Church and AIDS. But, like, there was
no. Start the podcast over. Let's begin from let's start from the beginning.
The Catholic Church was like anti-condoms and all this kind of, the sisters were very publicly critiquing the Catholic Church at this point because instead of providing quality education about the disease, the Catholic Church, would just, denigrate people and shame them, which isn't particularly helpful.
You must atone for your sins of being gay.
Pretty much. So the sisters started to do what the church wouldn't, and they provided that quality education about the disease. They would give like plain text, plain language pamphlets that just straight up explained what the disease was, how you got it, that kind of thing. They provided practical guides to practice safe sex and keep other partners safe. Not just, for gay men, but for people just in general. But as we begin to get further and further into the crisis, people are dying.
Yeah.
People are genuinely dying and terrified of what's about to happen. And for a lot of people, when you're faced with the prospect of mortality and death, you turn to a spiritual direction. You turn to churches and you turn to spiritual leaders. But so many of them were not filling that role for people.
No.
Especially for queer people that were dying.
Right.
So the sisters started to fill that role too. And a lot of the sisters were actually Christian themselves and continue to practice. So for a lot of them, they, began to view this role not as like the campy social critique performance that it started as, but like as an actual spiritual vocation. Right.
Wow.
And so they started performing religious services and delivering ceremonies and religious rites. Some of them even conducted exorcisms for people.
Oh my God.
This is becoming this is becoming like a real thing. They were really filling this spiritual gap that people needed.
Right.
Because
if you had HIV, like you were just shunned. You were just shunned from the social order.
And so, for the Sisters of Perpetual Indulgence, it had very quickly kind of evolved into a real order of nuns, like real nuns that were, doing the things that nuns typically do, comfort the sick and dying, providing, pastoral care, spiritual comfort and guidance and connection, that kind of thing.
Yeah.
And, they exist today. There are orders all over the world, including a related order of lesbian monks that are called the Brothers. So the sisters and the brothers, they take genuine vows of service. There's a process to becoming a sister that has, 4 steps that are reminiscent of, the traditional 4 steps to become a Catholic nun. The process takes at least a year, if not longer.
Wow.
So it's a legit order of, gay nuns. And I love them. They're great.
They are great. They're very sweet.
As you can, kind of see, the community had to kind of come together to care for each other because no one else was going to do that for them, unfortunately. In the face of this unimaginable loss, that collective grief, however, would soon simmer into anger, and that anger would turn into action.
Act up.
So next week, we're going to talk about the story of Larry Kramer and Act Up, the movement that turned grief into power, silence into protest. We're going to look at how activists forced governments and scientists and the public to finally listen, how their tactics changed the course of the AIDS crisis forever, and how we should and could be looking back on them for blueprints on how to tackle some of our current problems that we're experiencing to this day. So if you like this episode, let us know. If you're listening on YouTube, leave a like, subscribe, comment, all that kind of stuff. Get in the doobly-doo.
That's right.
If you're listening on Spotify, you can leave a comment there too. So definitely let us know what you thought of the episode. We love hearing from everybody.
Please.
You can find more episodes wherever you get your podcasts or directly on our website at .fempodcast.com. If you really enjoy queer history and want to help preserve our stories, help us tell these kinds of stories, you can support us financially by joining us on Patreon, where you can hear the full unedited interview with Dr. Fauci.
You got it this time!
If you have suggestions for other queer histories you'd like us to cover, definitely let us know. You can send us an actual letter. Our address is on the website. You can also fill out a form on our website if you'd prefer to send us an email. So we love hearing from everybody, especially those local histories that we otherwise wouldn't know about. So those are important too.
Tell us about the cool person in your town.
That's right. But with that, we will leave you until next week, where we will finish up the story of the AIDS crisis with Act Up.
And Larry Kramer. Bye.